Good afternoon, ladies and gentlemen, and welcome to your health program, You and Health, aired on Equinoxe Radio, a multimedia. For presentation, I am Esie Lucy Lengu. Early detection is one of the major ways of limiting the fatalities in connection to colon cancer. In this edition of your program, we'll shed light on the critical importance of colon cancer awareness while diving on the risk factors and also treatment options. And my guest for today is no other person than Dr. Theodore NGATCHU. He is a gastroenterologist. Good afternoon, Doctor, and we are glad to have you on the program today.
Thank you very much, Lucy, for having me on your program. It gives me pleasure to create some awareness to the Cameroon public about colon cancer.
Thank you very much, Professor. And without any waste of time, we'll go to the first question. We'd like to understand, what is colon cancer all about?
Right. I think it is important to understand first and foremost what cancer is. Cancer is basically the unregulated growth of parts of the body. They grow in a disorder manner that they cause damage to other things and cause diseases. Colon cancer is such a growth that happens to occur within the large bowel. And this normally begins as a small swelling that can take up to 15 years before it becomes significant when we talk about your health.
And now, who is more likely to suffer from this condition?
Now, colon cancer has got various aspects in terms of risk factors that make somebody more susceptible to developing colon cancer. Now, what I would like to explain is that only 20% of colon cancer are due to genetic diseases. So these are actually inherited cancer syndromes, cancer conditions. So 80% of colon cancer occur as a new condition in an individual. Now, what are the risk factors for colon cancer? Let me group the risk factors into two groups. You have risk factors that one can change and risk factors that one cannot change. Now, risk factors that one cannot change are things like age. We know the older you are, the higher your risk of cancers, colon cancer included. Okay. Other risk factors that you cannot change is something like your family history. Now, if you have a family history of colon cancer, you also have a higher risk of colon cancer. We know you cannot change your sex, although we do surgery to change sex, but your biological sex remains the same. And in certain areas, certain studies, a slight increase of colon cancer in men. We also know that being of African descent slightly increases your risk of colon cancer. Other conditions, like if you have some certain type of illnesses, some of them you cannot change them, and they increase your risk of colon cancer. That illnesses such as chronic inflammatory bowel disease, they increase your risk of colon cancer. Illnesses such as having growth hormone abnormalities, where you have gigantism, increases your risk of colon cancer. Now, risk factors that one can change, smoking is at the top of the list. We know people can stop smoking, and those who smoke have a higher risk of colon cancer. Okay. Being overweight has a risk of colon cancer. Those who are overweight have a higher risk. There is evidence that people with diabetes, type 2 diabetes in particular, also have a higher risk of colon cancer. And there's a thinking that in the condition of type 2 diabetes, the main problem is that the body is resistant to the effects of insulin, and so there is too much insulin in circulation. And they think that the too much insulin in circulation also stimulates the growth of cancers.
All right. And ladies and gentlemen, when we hear of cancer, we are worried because we know that cancer is one of those pathologies that affect many across the world that is fatal. And you might have your question, you might have a worry. This is an opportunity for you to ask your questions. You can call us via the numbers 670-547049, 670-547049, or you can reach us via 656-62-2222, 656-62-2222 at the end. And now back to you, Doctor. Who is at risk of developing this? You have already mentioned that type 2 diabetes patients and the rest. And now we also want to understand, why are many people in Cameroon at risk of this pathology?
Right. Now, there are also other conditions, particularly diet. Okay, there is some evidence that people who eat foods that are very rich in red meat, okay, tends to develop colon cancer more than those who eat less fatty foods. So people who have low vitamin D tend to develop colon cancers. So people in Cameroon, to be quite honest, I don't think Cameroon as a country actually increases your risk of colon cancer. There is evidence that more cancers are found in people who are more affluent. So in the richer countries, they find more cancers than in the poorer countries. Maybe it's because of their health-seeking nature, maybe because they have facilities of having investigations carried out which can identify these conditions, and so there's better reporting. In Cameroon, we don't have that high level of reporting, so our prevalence of colon cancer is not as high.
But approximately, let's say between 1 and 10, how many people suffer from this pathology in Cameroon?
Now, the prevalence in Cameroon is very varied. I think the average prevalence of colon cancer in Cameroon is between 2 and 8%.
Okay.
Yes.
And I want to know, like, you walk us through the various options that are available to detect or to diagnose colon cancer.
I think that is a very good question. It's a very good point, and I think it's actually important, particularly as we are talking about creating awareness for colon cancer. I think it's very important that the awareness actually leads to increased detection. Now, when we talk about detection of colon cancer, I think I would like to start by talking about screening for colon cancer, because we know, maybe I might digress a little bit, but colon cancer, like I said earlier on, can take up to 15 years to grow from the early stages to the point where it becomes significant. So if at any point in between those times we can identify the cancer, then we can treat it. We know that treating the cancer at an early stage has a very good long-term prognosis. Okay. So what we want to do in screening, we want to do a test that can identify the cancer at the early stage. We want to do a test that is cheap, that anybody can afford it. We want to do a test that does not cause any harm to the person, is not invasive. So the various steps of screening for colon cancer, I will start by distinguishing the different types. We have the stool-based tests, we have the blood-based tests, and we have the technology-related tests, which includes the visual test and the radiology test. Let me start with the stool test. The stool test is where you take a sample of stool and you can test it. You do a chemical reaction to see if there's blood in the stool. That is called, normally you will hear they say fecal occult blood test. No, that is to test if there is blood in the stool. That's a chemical test. That test identifies if there's blood in the stool. Usually the suggestion is that if there's blood in the stool, it's likely as a result of cancer. There are other things that can cause blood in the stool, and there are other things that can make that chemical test positive. So the false positive of that test is fairly high. So you can have a positive test without having cancer. There is another test they call the fecal immunochemical test, which is an immunologic test. So antibodies identify blood in the stool. That test is much more specific for blood in the stool, and so it has a higher specificity for bowel cancer. So you can do DNA tests in the stool and you identify DNAs that have come from cancer cells. That is equally higher. So those are stool tests. Blood tests, you can test for certain markers that come from bowel cancer. And we have something like a carcinoembryonic antigen test, which you do on a blood test, and it tells if there's cancer in the body, bowel cancer. Then now you have imaging tests. So radiology, you can get a CT scan to look at the bowel and to see if there's a cancer in the bowel. And the final test is a colonoscopy, where you get a camera up the back passage, it looks at the bowel. Now, each of these tests has its advantages and disadvantages. But in today's colonoscopy tests, now a colonoscopy test will identify the cancer, it will take a sample, it will send it to the lab, it will confirm the diagnosis. If the cancer is at the early stages, you can have the cancer removed at the same time. These are things that I would just like to highlight, that this kind of technology or procedure, we will be doing that in the center that I lead, Premier Health Center. So Premier Health Center will be doing colonoscopies where they can remove colon cancer in the early stages. Now, all the other tests, the CT scan, if it's positive, you need to have a colonoscopy. The blood test in the stool, if it's positive, you need to have a colonoscopy. But the colonoscopy is not cheap, so we cannot offer colonoscopy to everybody.
How much is it? Let's know how much it costs.
Well, it will depend. It will depend. A colonoscopy, averagely, just a diagnostic colonoscopy, will probably cost about 100, 150, and I think that is really, really cheap, because the cost of the whole procedure itself is maybe more than that. You know. Now, if you have to start doing interventions, the price can go up. But I don't want to talk about the cost of colonoscopy, because that is a life-saving procedure, and your life hasn't got a cost. I want to talk about the screening test. The fecal occult blood test is fairly cheap, and that you can do to everybody. Now, only those people who have a positive test will need to go on to have a colonoscopy. And you'll have a smaller proportion of people going for colonoscopies, and that makes it cheaper overall for screening.
We have spoken about the means at which we can diagnose this disease, but let's come back to the symptoms. I'm sure many out there are a little bit confused. Let's come back to the symptoms. How do we know that we are suffering from colon cancer?
Now, I'll first of all start by saying to know you are suffering from colon cancer, you need to go and see a doctor. You need to see a doctor who specializes in that area to be able to know that. You, as anybody who is not a doctor, who has not got medical training, can have symptoms, they might not know what it is. But some of those symptoms depend on where the cancer is located in the large bowel. Now, the large bowel is a long piece of tube that is almost about 2 meters long. Okay, and it depends on which side of the bowel the cancer is located. If the cancer is located in the side that we call the right side, the right side of the colon is very big, so a cancer can grow to a very big size without you even noticing it. The only way you identify it is because it's losing blood and you have become anemic. When you're anemic, you feel very tired, you lack energy, you're out of breath when you do a little exercise. So those things, you don't know if it's cancer or anemia because of malaria or something else. So you need to go and see a doctor. When it's on the left side, it can either bleed and you get bright blood in your stool, or you get a blockage because the left side of the colon is smaller, the stools are harder. It can cause blockage. You know. And if you get a blockage, it becomes an emergency, you have to go into hospital. So in any case, if you identify some of those symptoms, it's good to see a doctor. The key ones is, if you have bleeding in the stool, you see a doctor. If you normally go to the toilet, say, once every 2 to 3 days, and your stools are normally hard, and all of a sudden you start going to the toilet 2 to 3 times a day and you start getting diarrhea, particularly in somebody who is over 40 years old, you should actually go and see a doctor.
And what is the cure for this condition?
Now, the colon cancer, the outcome of treatment depends on the stage at which you pick it up. Like I said earlier on, if you pick up the colon cancer at the early stages, you can cure it even at colonoscopy. So you don't even need an operation. If you pick the cancer up at a stage where you cannot cure it at colonoscopy, you can have surgery, and the surgery can cure the cancer completely. If you pick the cancer up at a later stage where it's gone outside of the bowel, you need surgery and you might need to add chemotherapy. If the cancer is actually spread to other areas of the body, you probably might need more than one type of surgery. I don't want to go into the details, nitty-gritty on the various type of things you can do at the various stages, because that requires somebody who is more professional into that area. I don't think it's for general public consumption.
And traditionally, can this condition be treated too? For those who like to find out, who like to know if they should go medical more or traditionally.
Well, I'm not very conversant with traditional medicine, so I cannot tell you if traditional medicine can. I personally, I would advocate that if somebody has a diagnosis of cancer, go and see a doctor who has proven evidence that the cancer can be treated. And the doctor should be also honest to tell the patient, knowing the stage of the cancer, whether that cancer is curable or not curable.
What are lifestyle changes to consider when we are suffering from this condition?
Now, I think lifestyle changes with regards to colon cancer should actually be considered in the prevention stage, not when the condition has been diagnosed. So I would think before you even come to having bowel cancer, we should consider our diet, we should consider our habits like smoking or like our weight. We should try to manage our weight. Those are the sort of lifestyle changes I think we should consider before the diagnosis. Once the cancer has been diagnosed, I think the only other lifestyle change is just to maintain a healthy life.
So diet does not play a role within that period?
Once you have been diagnosed with colon cancer, diet plays no role. Diet plays a role in maintaining your body healthy so you have enough energy to fight any eventuality from the disease.
So what other forms do you suggest to prevent this condition? What other factors do you suggest?
Now, these are methods that I think for Cameroon, it's something that we need to look into and think about it carefully. Now, there is what we call surveillance. So some people who have conditions that we know that their risk of colon cancer is high, they should actually undergo a surveillance program. Let me start in this way. Now, if you have a family history of bowel cancer, in particular, if somebody in your family, like your brother, your sister, your father or mother, had bowel cancer in their 40s or 50s, your risk of bowel cancer is very high. So you have a 20 to 30% chance of developing bowel cancer yourself before you get to that 50. So in that situation, you need to be having a screening test. Now, in this situation, a fecal occult blood test is no good. These are the people who need to be having a colonoscopy. They need to be having a colonoscopy on a regular basis. Now, in Europe, these people will be having a colonoscopy once every 5 years. So if you have a family history with strong evidence that your risk of bowel cancer is high, you need to be having a colonoscopy on a regular basis. If you have a colonoscopy and they find you have polyps, when they remove the polyp, you need to be having a surveillance colonoscopy regularly, depending on the size of the polyp and the diagnosis, the histology of the polyp. Now, if you have bowel cancer and you have an operation and you've been cured from the bowel cancer, you need to have a surveillance colonoscopy. This group of people, they don't need a screening test. They need a surveillance test, which is a colonoscopy. Some people colonoscopy because of the cost or because of the discomfort or any reason. They should be having a CT colonography. So a virtual colonography done with a CT scan. And it has to be done with a specific type of CT scanning, not a box standard poor quality CT. It has to be a high CT.
All right. Thank you, Professor. Any last advice for our listeners and viewers out there? when it concerns the pathology?
When it comes to cancers in general, take your health seriously. When it comes to colon cancer is a cancer, if picked up in the early stages, is a condition that you can be cured of. So those who are at risk, check yourself. If you are getting to a certain age, make sure you do your fecal occult blood test, and if it's positive, get a colonoscopy.
All right, thank you very much, Professor Theodore NGATCHU. It was a pleasure having you on the program today.
Thank you very much for having me.
And for all our listeners and viewers out there, you never had the opportunity to call, you have the numbers on your screen. You can equally call after the program for more questions, or maybe you wanted to discuss with the doctor or the medic. You can get to us after the program. We have come to the end of your program, You and Health, aired on Equinoxe Radio Multimedia. And for presentation, I am Monsieur Lucy Liengu. At the technical dashboard, we had Bertram Bonzini and Jonathan Babiola. Stay in the company of interesting programs on Equinoxe Radio and television. Bye-bye for now.